Hi, everybody. I'm Michael Carisse, welcoming you to Raise the Line with Osmosis from Elsevier, an ongoing exploration about how to improve health and healthcare. On this episode, we're continuing our NextGen Journeys series featuring fresh perspectives on education, medicine, and the future of healthcare with Jermaine Blakely, a third-year medical student at Howard University College of Medicine. Before starting med school, Jermaine spent several years working on electronic health record integration and laboratory information systems management at hospitals in San Francisco, which helps explain why he also co-founded the Health Innovation and Technology Interest Group at his school. Outside of med school, Jermaine was previously a venture fellow at Health Innovation Capital, and he's currently an AI clinical fellow and assistant to the CEO at Glass Health, which is a health tech startup. And we want to thank a previous Raise the Line guest, Dr. Parsha Mori, for putting us in touch with Jermaine Blakely. It's great to have you on the show.
Thank you. I'm happy to be here.
So we always start with trying to learn more about our guests, and particularly what got them on the path toward a career in medicine. Obviously, you had quite a bit of work experience before you decided to go to med school. Why don't you give us some background?
Yes, I'm from a small town in Alabama, very rural area. The access to healthcare was very limited. And one of my first experiences with the medical institution was probably around 7th grade. My mom was in a bad car accident, and we had to go to the emergency department. And the emergency department was about 40 minutes away in Mississippi. So I stayed on the state line of Alabama and Mississippi. I think there's like the rural black belt. And from that particular instance, I realized how the access to emergency care was so prevalent and so dire in certain situations because it hit so close to home for me. And my mom is also actually a nurse. So she more so also pushed me into the direction of medicine. And I think I came from a small town where most people in my town, they work at factories. That's mostly what the men do for good jobs and a good living. But I think for me, I just really saw myself as being bigger than my circumstance. And I wanted to see the world, and I read a lot. And I thought that education and medicine was a pathway for me to not only get out of my small town, but to also make a huge impact somewhere in the world. I'm still figuring out exactly what I want to do, but I do think medicine has been the best career choice for me, giving all of the values and principles within this particular career. So I don't think it's perfect for sure, because I have a lot of complaints, but I do think it's fairly the most favorable career. If I had to choose anything else, I would probably still choose this.
Yeah. Well, I'll say two things. We've done nearly 500 interviews for this series. And number one, you're not the first person to have complaints about being in medicine, for sure.
Sure.
And also what we hear from a lot of folks is just it opens up so many opportunities. There's so many ways to be in medicine, to be a physician. You don't even have to be a clinical practitioner. You can be a advisor to a company. You can start a company. You can do all kinds of other things. So
totally agree.
I think what you're saying has some wisdom behind it. So you're on this track, you get a bachelor's degree in biology, but what might not make some sense to people is that you, before going to med school, you get a master's in health policy and management. So tell us about your thinking behind that decision.
And that's a great question. So I was pre-med in Morehouse College in Atlanta, Georgia. And during my time there, I did very well academically, but when it came to the medical school admission test, I wasn't super confident in taking the exam just yet. So I went to graduate school, to be honest, to more so prolong my decision-making to what type of career I wanted. But while I was at Morehouse, I started this organization called Project House, and it was an organization that focused on the homeless population there. And we didn't have another organization on campus that focused on the homeless specifically. So I did a thing where I kind of saw a gap and I saw a need to fill. And I went out into the city of Atlanta and I partnered with churches because churches had church buses, and we partnered with different churches who had church buses, and the buses would come to campus and pick up students to take us to the homeless shelter. So I partnered with churches. We partnered with Krispy Kreme Donuts because they provided us with some funds so that we can purchase shirts, t-shirts. And one thing I realized is that, wow, like the marketability of community service is a real thing. And if you make community service seems like a very cool thing to do, more people will be interested in doing it. And I think one way we made community service cool was by the t-shirts that we had. We had these nice, cool baseball tees that was sponsored by Krispy Kreme donuts. And then I also went out and we partnered with a transitional home that focused on women who were in domestic violence situations. And I think from working with Project House and strategically partnering with community stakeholders like churches and homeless shelters and transitional homes, and being able to influence large group of students at one time, because at that time we were working with students from Morehouse, Clark Atlanta University, and also Spelman College. And I realized, wow, I can really impact change in a health way via more so big strategic thinking and operations and actually mobilizing people for a certain cause. So I applied to NYU because they had a master's in public administration and health policy and management. And specifically the school at NYU was the School of Public Service. And it gave me a fellowship which paid for my entire tuition based on the work that I did
Wow.
with homeless in Atlanta. So I went to NYU to just more so learn more about the operational side of healthcare. I was like, okay, maybe this is more my thing than the science. So that's how I ended up at NYU.
Yeah. And during the NYU experience, did the science side click, or how did you get back on the track for med school?
Right, that's a great question. So I chose NYU because it was actually, I was choosing between MPH, so Master's in Public Health, and versus a Master's in Public Administration. NYU was the only Master's in Public Administration and Health Policy and Management program I applied to. And I went there because it was the least scientific curriculum. So my class was mostly focused on economics of healthcare organizations, stats, financial management, et cetera. However, I did do an administrative fellowship right after NYU at the University of California, San Francisco Health System. And it was really my experience at UCSF, which I think has some of the most brilliant physicians that I've ever met that were doing way more than practicing at the bedside. And I think that I was reinvigorated to go into medicine again, just from my interactions and experiences with physicians who were doing more than just practicing at the bedside. They were practicing at the bedside. They were doing research. They were teaching. They were also leading big strategic initiatives under the CEO. At the time, it was Mark Larrett. And I was like, wow, a physician can do all these things. I think I want to go to med school again. So I actually applied to med school because of my experience at UCSF.
Wow. Well, I think probably with all the thinking you did and all the experiences you had, I imagine that being there now, you sort of feel like you're in the right place. It's not just a whim. It's not something you're doing for somebody else. It's something that you really have decided is right for you.
Yeah, that's a good point, because I think I came to medical school at 28 years old. So I took about 5 years between being in school at all. So I graduated from NYU in 2017, took about 5 years before starting med school in 2021. And the thing is, I came to medical school a little bit older, a little bit more mature, and also just more informed about what I wanted to do in my career. So I came to medical school with the impression of maybe I just want to practice for 5 years. And then I went through my first and second year of medical school, and I was like, actually, I don't want to practice at all. However, in my third year, and I think because I started this organization that focused on healthcare innovation and technology, and we bring industry experts on campus. And I've been doing this research, more so picking the brains of industry experts and asking them like, oh, do you think I have to go to residency? Do you think I have to practice in order to be credible if I do decide to start a company one day? And I would say that majority of the answers is yes. They recommend at least doing residency to have that, from more so respectability politics, but also knowing that you had an experience actually practicing on patients as a physician or as a full medical degree professional. You just have way more insight in terms of how, if I do decide to create a clinical product one day, how to operationalize that within a healthcare system or organization or institution. So I think as I've matriculated through Howard College of Medicine, I've been able to inform what I think I need to do best. So at this current juncture, I'm thinking that I should complete residency, but I'm very open to starting up my own company or going into a startup or going into a venture capital firm right after residency and foregoing practice, unless I feel like I'm very in love with a particular specialty.
We should definitely connect you with Shiv Gaglani, who's the co-founder of Osmosis.
Yeah, I read some of his story.
Yeah, he's quite amazing, and he's been through a lot of this same thinking. He dropped out after 2 years of med school, started this company, really grew it successfully with the whole team, and is now back in med school. He's a third-year med student himself at the age of 33 or 34 or something. Yeah,
yeah, that's so funny because I actually read that he was going back. I remember when he was going back to medical school, and I think I read the announcement on LinkedIn, and I was like, "Wow, that's interesting." And because I did hear that he dropped out of med school, and I was like, "Okay." And his career journey has been super interesting. Would love to talk to him and learn a little bit more about him because I think we may share some similar perspectives about the medical industry and what we want to do and how we feel like we can impact change within it.
Yeah, right. And I think that's kind of a theme is that, people realize, I mean, this was not common, 20, 30 years ago for physicians to be entrepreneurs relative to what's happening now. And people felt like they could only make change from within the medical system. And this Shiv's a great example, but there's many, many other examples of people helping to improve healthcare. That's still, they still want to help patients and they want to improve people's lives, but they can do it from outside the system and pick their piece of it. In his case, it was medical education. In your case, it might be something completely different. But there's a lot of energy around improving healthcare, and it's just sort of like, from what perspective are you going to do that,
Right.
So you guys would hit it off, believe me.
Love to meet him. I'll follow up.
Well, and just obviously just listening to you for a few minutes, I mean, you have a real entrepreneurial sort of spirit and a great deal of leadership talent. I mean, to put these organizations together and start all these things. So
thank you.
We'll have to keep our eye on you for sure. Listen, so, you did mention that there was a 5-year break there. Mm-hmm. Before you enrolled in med school. During that time, you were out in California, as I mentioned in the intro, working on electronic health record and healthcare IT. And I'm just wondering if you could help people understand. Well, I guess first I would like to know how that probably helped you getting to med school, being in a hospital environment. You already understand how complicated hospitals are and how many moving pieces and parts there are. So talk about how that has influenced your journey in med school.
Yeah, that's a great question. I graduated from NYU, and my introduction to healthcare technology was between my first and second year at NYU. I worked at Kaiser in Oakland, well, basically in Berkeley, California, and I worked in a clinical technology department. And basically the department that I worked at was responsible for the maintenance and the upkeep and the requisitioning of medical equipment across all of the Kaiser hospitals in the Northern California region. So it was about maybe 12 hospitals. And my job was redesigning their website for maintenance requests and procurement of new equipment with project management and engineers. So it was my first introduction to like the world of medical devices within a larger healthcare system. And I think Kaiser is a great example of a well-run machine. So I went to UCSF, and during that time, I started an administrative fellowship. So I did a fellowship. It was 2 years. I would choose between Northwell and UCSF, and Northwell is in New York. So I was choosing between to stay in New York or to move to San Francisco. And I decided to move to San Francisco because when I thought about the health systems there in my 20s, I wanted my 20s to be devoted to learning from some of the best organizations and being in the best regional location. And I think when it comes to healthcare, I truly think personally, from my experience thus far, that no one does it better than the West Coast. And I think the Northern California region, you have the Stanford Health, you have UCSF, you have Dignity Health, you have Sutter Health, organizations and Kaiser too, don't forget to mention that has been doing it really well. And during my administrative fellowship, we get to rotate around the C-suite. So you get to choose anybody to work with. And I have a great mentor there, Heidi Collins. She's the Associate Chief Medical Information Officer there now. Well, she's the Associate Chief Information Officer now. She's not a physician. And she put me on this big project where we had Epic. So Epic is the electronic medical record at UCSF. And UCSF acquired Oakland Children's Benioff Hospital in Oakland. And I was more so tasked with operational readiness for the migration of these two Epic systems. Okay. And from this experience, it was like getting a crash course into what every specialty does, because the EMR touched literally every aspect of the hospital. And this for sure is a tool, but it's a tool that nutrition use for their dietary plans. It's what the pharmacy use for their formularies, which is the medication list for all their patients. It's what the clinicians use for their medical orders. So I had a more so preview into how every specialty, every physician, mostly nurses, every operational function within the hospital leverages the electronic medical record. And I think it just more so opens my eyes to what technology can actually do when leveraged correctly for patient care and the continuum of patient care. And from that experience, I was like, wow, okay, I just really learned that the possibilities, if I was to be a physician, but also have the understanding of the nuances of how to leverage technology within this current time, because there is an AI revolution happening right now within medicine. But at that moment, there was a revolution of more so like electronic medical records consolidation. So being there at that intersection at that right time, I think that my career I've been very fortunate to more so have preview into experiences at the right place, the right time, been in proximity to some of the best tech startups since we're very close to Silicon Valley.
Sure.
And from all of those experiences, I came to medical school just way more informed about what the future of healthcare can be and what I can do potentially to serve in that.
Yeah, that's fascinating. And we are going to get to AI, but first on electronic medical records, I mean, I think sometimes people lose the context that they're new, really. I mean, in the grand scheme of things, it's only been 15 years or something like that these things have been around, and they've gotten a pretty bad rap for interfering with the delivery of healthcare. You know, the classic example is the doc is looking at his computer screen and typing instead of looking at the patient and engaging in that way. So what, I guess somebody with all your experience, you know, on the tech side, but also now on the practitioner side, what's your take on, you know, their overall impact and maybe how they could be utilized differently? So, you know, they're doing all the amazing things they can do in terms of making healthcare more efficient and safer and all of that, but
Right.
not interfering with the relationships.
Right. I totally agree. I think it's like a Swiss Army knife. There's pros and cons to the electronic medical record. I think to start with the pros is that you have a very enhanced continuum of care where you can share a patient journey with literally anyone who needs that particular information at a given time upon the interaction with that particular patient. I think is definitely a form of record keeping. 3, I think that most health systems, if they're not acquired by a bigger health organization at this very moment, are simply breaking even or maybe in the red. And I think electronic medical records have been able to enhance revenue capture in a way that we've never seen before in terms of billing and coding. And I do think that money pretty much motivates administration. So I think electronic medical records are here to stay. And I think it's interplay with the government and how it's used for meaningful use, which is basically what government agencies kind of use as a metric, like how well are you using your electronic medical record to decrease readmissions or improve patient care and patient outcomes. Mm-hmm. So I think because they're so ingrained, the pros of that is, number one, I would say continuum of patient care enhancement. Number 2, I think there is enhancement for your revenue capture. And number 3, I think it allows a larger form of collaboration within your own health system. Okay, the cons of that though, I do think that it at times it can take away from your patient one-to-one interaction from a conversation. And I do think that being very diligent on patient notes, because the provider has to actually know exactly what was documented, the diagnoses, the medical treatment, assessment, and plan, that can be very arduous and can increase the length of time that providers stay within their particular day-to-day functions. So I would say the cons of that, if you don't have a good electronic medical record, I do think it increases frustrations for everyone, medical students, residents, and physicians. And if it's not a good one, that means it's not easy to use and you're not choosing the right one. So I just think that the EMRs currently are here to stay. And I do think that healthcare organizations should invest a significant amount in a really good one because it pays itself off. But if you go the cheap version and get an electronic medical record that's not as sufficient or efficient, the consequences down the line can be very drastic financially and also emotionally and mentally for everyone that works there.
Yeah, because we do hear a lot about their contribution to burnout as well. But
For sure.
that kind of leads me into the AI conversation, because there's all kinds of AI tools that are coming on board to automate some of this, I guess, the administrative side of being a physician. Well, some of it's clinical, taking notes and all that, but there's automated transcripts and there's other ways of kind of helping the workflow of a physician. So I guess, what are you seeing in terms of how AI is being applied now on the positive side of things, and where do you see it? Is it going to stay on more of the admin side of things, or it's obviously being used for clinical stuff, but how far into the clinical realm do you see it going?
Yeah, that's a great question. So I'm very excited about this revolution of AI within the healthcare space, because I think this is only the beginning, and the advancements of these large language models, like your chat GPTs or your Google, I forget what they're called, but MedPalm is the Google version of the chat GPT. I think the advancement and the trajectory of AI is moving so fast. So one of the reasons why I started the Healthcare Innovation and Technology Group at Howard is because I want to just make sure that my peers and my colleagues are aware that if you don't get involved now, you can get left behind. Not left behind in the sense of your clinical knowledge, but left behind in the sense of the type of opportunities that's going to be there in the future, that once you graduate with your medical degree, which should open doors for you in so many ways. But there's like chief AI officer positions currently today that never existed before, that's been here about like 2 years now.
Yeah,
so
right.
If health systems believe that they need a chief AI officer with a large salary, there's a reason why that's to come. So my particular opinion about AI within healthcare, I think AI clinical decision support integrated with an electronic medical record will be the bread and butter of AI for health systems. I think physicians today may be scared of potential risks that comes with AI. But again, I said AI clinical decision support. So if used correctly, and if AI is integrated within your EMR, at Glass Health, we have a platform called Odyssey, which integrates AI within the electronic medical record, Epic specifically. And not only does the AI create differential diagnoses, which, of course, as a provider, you're learned to create your own differential diagnoses, but the AI would just spit out multiple differential diagnoses, and you may miss one because we're human. I think we just kind of have to we have to surrender to the fact that AI will always be smarter than any human being in a lot of ways, maybe not in bias and in emotional intelligence, but in terms of actual facts and having that volume of knowledge at one time, AI will probably win every time over a regular human physician. However, today, AI can help with assessment and planning. So because there are things that a physician just may not think about. And again, these are only recommendations. So if you leverage AI correctly, you will see it for just simply support decision-making. So recommendations, but it's not directives. And I think the narrative around AI should be, this is another form of clinical decision support, which we already have within electronic medical records, which often serve as pop-ups. So for today, before AI, if you were to give a patient a medicine and he's allergic to like penicillin, you will probably get a pop-up within the electronic medical record. Before when you prescribe penicillin, you will get a pop-up saying the patient is allergic to penicillin. Are you sure you want to prescribe penicillin? Right. So we already had these things. I think we just have to wrap our mind around that we now have enhanced, advanced versions of what we already have, and that we don't have to put 100% of our trust in AI. But if we were to use it correctly, patient outcomes will increase, physician burnout will decrease, because now you even have ambient listening within most of these AI platforms, where you can talk to the patient and literally the AI would just scribe everything for a provider. And not only would they scribe everything for a provider, hypothesize what they think the differential diagnosis is from that conversation, and the assessment and plan, and the management. And I think that's a whirlwind for everyone. And also, we currently have scribes today, which are in human form. AI can actually replace those people, which can also save money for particular departments within the healthcare system. I don't advocate for the replacement of people's jobs, but I do think that there are some low-level jobs that potentially could get not only replace, but maybe you could give additional responsibilities to that particular person. And we
Yeah,
can
that's right.
focus really advancing the healthcare system instead of staying stagnant.
Yeah, well, other jobs are created. You just made a great example of AI. A chief AI officer didn't exist, a couple of
Sure.
years ago. So it's there's some creative destruction of jobs, but
Creative destruction.
openings in other areas. And AI, like Elsevier, for example, has a decision support system, clinical key AI, and
Well, I heard about clinical key.
yeah. So they have the AI version. And I think, the concern you were implying there about accuracy or hallucination or
Mhm.
whatever, Elsevier is able to tap into this vast library of journals and research, publications that they have to help reassure clinicians that, this is trusted,
Mhm.
vetted clinical information. It's not coming off, a Google search or something. So
Right.
all this is still in the early days. And I think there's, this balance, finding that balance between using it as a tool and not maybe going overboard with it, but making sure you're using all of the advantages that it brings with the proper caution.
I totally agree.
So really fascinating time to be in healthcare. I'm afraid to say we're nearly out of time, but we'd always like to ask our guests to leave with a little advice. I mean, you've got a lot of experience under your belt, more than the average medical student. What's your go-to advice for, say, people coming into medical school about how to navigate all that and how to think about their career?
So what advice would I give an incoming medical student? I would say that I think that everyone in medical school comes in with a vision for what they want their career to be. And most of the times when you ask a medical student what he or she wants to be and what specialty, and I think most of the time, because it's so constructed, when people ask a medical student a question about their future career trajectory, the question is often, what do you want to specialize in? And people say, most men these days in medical school want to do orthopedic surgery. A lot of female medical students want to do dermatology or OB. And I think we're asking the wrong questions to medical students. I think we should ask medical students, what all do you want to do with your medical degree? And I often emphasize that I know me personally, my medical degree is a stepping stone. And from my current time in medical school, I've had to be very protective about my vision, even during the times when I just thought I didn't want to practice at all. And I wanted to create my own business, but also be clinical so that I could work on clinical products. And I have the clinical knowledge to make clinical decisions about future advances in technology. A lot of people don't understand what I'm talking about. And that's okay, And I would say that it's important to wherever your vision is to protect that vision, to know when to speak that vision, to know when to share that vision, to know when to ask for advice and input about what you want to do. Because if you talk to too many people, their fears and also their limited thinking in terms of what a medical physician is can sometimes distract you from what you feel like your ultimate goal is. So to summarize, I would say that my advice would be to get your medical degree as a passport to do a variety of things that are yet to be imagined. And if there's something that yet to be imagined, imagine it. And also keep a list in your phone of when you're in a hospital on your third year and fourth year rotations, keep a list of the things that you want to change. Again, I think most of us have complaints. I think I'm very hypercritical of this organization. And I think so many things can be done better. You should keep a list of the things that you think that you can create and build. And I think we should be pouring that into our medical students. We should pour into our medical students to empower them to make changes in even the small places. Even if we don't like a syringe, how can this syringe be better? Even if we don't like a Foley catheter and how we insert those into particular parts of female and men, if we don't like those particular tools, we should create a better one that we think would make the patient more comfortable. So again, your medical degree should be a passport to many different career paths. And two, I would say to dream big. With your medical degree, we work really hard to be here. We work really hard every day to obtain a medical degree. So I would say dream very big with what you want to do and protect that vision for yourself and your life. Yeah, and be courageous in that path.
Wow. I think people a lot younger than me call that a wisdom drop. There's an awful lot of wonderful stuff for folks to think about there. And it's really been great to have you on the show and kind of an inspirational conversation. So thanks again for your time and best of luck.
Okay, thank you so much.
And with that, I'm Michael Carice. I want to thank you for checking out today's show. And as always, remember to do your part to raise the line and strengthen the healthcare system. We're all in this together.
If you like this podcast, please share it on your social channels. You can also subscribe to the series and check out all of our episodes at osmosis.org/raisethelines podcast.